More than 1 in 10 deaths globally was caused due to smoking in 2015, and over 50% of them took place in just 4 countries, one of which was India, a new study on Thursday said. Over 11% of 6.4 million deaths worldwide was caused by smoking in 2015, and 52.2% of them took place in China, India, USA, and Russia, according to the latest estimates in the Global Burden of Disease (GBD) study published in medical journal The Lancet. China, India, and Indonesia, the 3 leading countries with male smokers, accounted for 51.4% of the world's male smokers in 2015. India has 11.2% of the world's total smokers. Deaths attributable to smoking increased by 4.7% in 2015 compared with 2005, and smoking was rated as a bigger burden on health, moving from 3rd to 2nd highest cause of disability, the study said. In 2015, 11.5% of global deaths, 6.4 million, were attributable to smoking worldwide, of which 52.2% took place in 4 countries, China, India, the USA, and Russia, the study said. The estimates are based on smoking habits in 195 countries and territories between 1990 and 2015, and illustrate that smoking remains a leading risk factor for death and disability. The study said that with growing and aging populations already heightening the burden of tobacco, it will be crucial to support more smokers in quitting and stopping people from starting to smoke. The USA, China and India, which were the leading 3 countries in total number of female smokers, accounted for only 27.3% of the world's female smokers, it said. While Indonesia, Bangladesh and the Philippines did not have significant reductions in male prevalence of daily smoking since 1990, the Philippines, Germany, and India had no significant decreases in smoking among women. The authors of the study warned the war against tobacco is far from won, and argued that despite implementation of the WHO Framework Convention on Tobacco Control in 2005, policymakers need to make renewed and sustained efforts to tackle it. Worldwide, between 1990 and 2015, smoking prevalence decreased by almost a third, from 29.4% to 15.3%. And presently 1 in 4 men, 25%, worldwide smoke, as do 1 in nearly 20 women, 5.4%. Despite these improvements, population growth has led to an increase in the overall number of smokers from 870.4 million in 1990 to 933.1 million in 2015, the study said. The study said Pakistan, Panama and India stand out as 3 countries that have implemented a large number of tobacco control policies over the past decade and recorded marked declines in the prevalence of daily smoking since 2005, compared with decreases recorded between 1990 and 2005. The study said the Framework Convention on Tobacco Control, FCTC, is necessary and vital for creating policy environment for more effective tobacco control worldwide, but not enough to fully address each country's tobacco control needs. The nations will need to both implement FCTC stipulated measures and supplement such policies and programs with strong enforcement and higher rates of compliance, it said. For example, India, where 11.2% of the world's smokers live, supplemented the Cigarettes and Other Tobacco Products Act, COTPA, with the creation of a National Tobacco Control Program, NTCP, in 2007. NTCP was created to strengthen implementation and enforcement of the various provisions of COTPA at the state and district level. It has been rolled out in phases and currently covers about 40% of all districts in India, the study said. The 10 countries with the largest number of smokers in 2015 were China, India, Indonesia, USA, Russia, Bangladesh, Japan, Brazil, Germany and the Philippines. Together they accounted for almost 2/3 of the world's smokers, 63.6%, the study said. Despite more than half a century of unequivocal evidence of the harmful effects of tobacco on health, today, 1 in every 4 men in the world is a daily smoker. Smoking remains the second largest risk factor for early death and disability, and so to further reduce its impact we must intensify tobacco control efforts, said senior author Emmanuel Agakidou, Institute for Health Metrics and Evaluation at the University of Washington, USA.